Warning about the risk of early puberty from antibiotic use. Research has shown a link between antibiotic use in infants and the risk of early puberty, especially in girls. Here is a summary of this risk. Important research. Analysis of over 320,000 children under 12 months old in Korea, followed up until age 9, girls, and age 10, boys. Girls who used antibiotics before 3 months of age had a 33% higher risk of early puberty. The risk increased by 40% if antibiotics were used in the first 14 days of life. Children who used 5 or more antibiotics had a 22% higher risk of early puberty than children who used 2 or fewer antibiotics. No clear link was noted in boys. Mechanism of action. Antibiotics can disrupt the intestinal microflora or affect endocrine metabolism, thereby affecting puberty. According to Professor Choi Yoon-soo, factors that affect the microflora or endocrine system early in life can promote early puberty. Consequences of early puberty. Growth. Children grow quickly initially, but their bones mature early, leading to lower adult height. Psychology. Children may have an inferiority complex, be at risk of sexual abuse, or be exposed to unhealthy behaviors early, smoking, drinking. Long-term health. Girls are at higher risk of breast cancer due to early exposure to estrogen. Alternatives to antibiotics. To reduce the risk of antibiotic abuse and potential side effects, such as early puberty, the following alternatives can be used, especially for mild viral illnesses, such as colds, sore throats, coughs. Natural remedies. Rinse the nose with saline, helps clear mucus, reduce rhinopharyngitis. Use a 0.9% saline solution or a specialized saline spray for children. Gargle with warm salt water. Useful for older children to reduce bacteria in the mouth, reduce mild pharyngitis. Strengthen resistance. Supplement foods rich in vitamin C, oranges, kiwis, guavas, and zinc, pumpkin seeds, beans, to support the immune system. And give children enough water and rest so that the body can fight the virus itself. Use honey. For children over 1 year old, honey has the effect of soothing the throat, reducing cough, and has natural antibacterial properties. Note: do not use honey for children under 1 year old due to the risk of botulinum poisoning. Probiotics. Supplementing with probiotics helps balance the intestinal microflora, especially when children have to take antibiotics. Probiotics such as lactobacillus or bifidobacterium can support the immune system and reduce the risk of endocrine disorders. For example, use yogurt or probiotic supplements as directed by your doctor. Natural essential oils. Peppermint, eucalyptus, or tea tree essential oils can be used for steaming or diffusing in the room, helping to clear the nose and support breathing. Note: only use high-quality essential oils, dilute them properly, and consult your doctor before using them on young children. Herbal medicines. Some herbs, such as thyme, licorice root, or ivy leaf, can be used as syrups or teas to reduce coughs and loosen phlegm. However, it is necessary to ensure that the product is tested and used in the appropriate dosage for children. Improve hygiene and prevention. Wash hands regularly, avoid contact with sick people. Keep the living environment clean, airy, avoid dust and cigarette smoke. Get fully vaccinated to reduce the risk of infection requiring antibiotics. Notes when using antibiotics. Only use when necessary. Antibiotics are only effective against bacterial infections, not viruses. Always consult a doctor and do an antibiotic test to choose the right type. Use the correct dose at the right time. Normally, the course of treatment lasts 5 to 7 days, sometimes up to 14 days, to ensure killing bacteria and avoiding drug resistance. Avoid self-medication. Parents should not buy antibiotics themselves or use old prescriptions for children, because this increases the risk of drug resistance and disrupting the microflora. Prevent early puberty. Proper nutrition. Limit foods containing growth hormones, such as fried foods, processed foods. Prioritize a balanced diet with natural vegetables and low sugar. Breastfeeding. Reduces the risk of early puberty thanks to the natural nutrients in breast milk. Monitor signs. If your child shows signs of early puberty, breast development before age 8 in girls, large testicles, or a deep voice before age 9 in boys, take your child to a pediatric endocrinologist for examination and treatment, usually with puberty delay drugs. Thank you for watching the video. Wish you and your family health and happiness.